Baker's cyst aspiration under ultrasound guided. Baker's cyst is also known as popliteal cyst. It is actually an enlarged bursa between the medial head of gastrocnemius and semimembranosus. It can be primary or can be secondary. Primary means when there is a Baker's cyst but there is no effusion in the knee. But if it is secondary, that means there is a anatomical communication from the knee synovial sac and the Baker's cyst. It can have a unidirectional mechanism, means fluid can come from the knee towards the Baker's cyst, but it cannot go back. Patients with Baker's cyst can complain of a vague posterior knee pain. There can be a swelling or a mass in the posterior in the popliteal space. There can be limited range of motion of the knee. Stiffness or tightness is felt in the back of the knee, and which sometimes increases by activity. Let us do an examination of a normal knee. Here we can see the posterior knee of left side, and probe is placed in a short axis orientation over the mid part of the knee. Here we can see semimembranosus and semitendinosus above. Semitendinosus was a muscle and gradually it has become a tendon. Now I am taking the probe from proximal to distal direction. Gradually, we will be able to see that semimembranosus is also vanishing and it is also becoming the tendon. Now we can see that semimembranosus has become a tendon, and above that a small dark dot, that is actually the semitendinosus tendon. Left side of the screen is actually showing the gastrocnemius muscle, and now we can see the condyle of femur. This is the medial condyle of femur, and above that even the cartilage line is also seen. Between the gastrocnemius tendon, which is a boomerang shaped tendon, and the semimembranosus tendon, that is the place where we should search for the Baker's cyst. Since this is a completely normal volunteer, we do not find any fluid there. Here you can see the semitendinosus tendon, which is actually looks like a black dot, but this is due to anisotropy. It can become black, can become white, means can become hyperechoic, can become hypoechoic also, as per the our probe positioning. If we go back again proximally, we see that the tendon is becoming muscle again, semimembranosus muscle. It is becoming the semimembranosus muscle. And then again, we are coming back to the place where we should search for the Baker's cyst. So now let us see in the left side, it is the gastrocnemius, medial head of gastrocnemius, and right side we can see both semitendinosus and semimembranosus, and between them that is the area to search for the Baker's cyst. Now let us see a case of Baker's cyst. Here you can see the gastrocnemius tendon on the left side, and on the right side you can see two black areas, which one of them represents the semimembranosus tendon, and above that is the semitendinosus tendon, and between this semimembranosus and gastrocnemius tendon you can see the area of Baker's cyst. Below you can also see the femoral condyle and cartilage above that. Here one important tips: when you are searching for Baker's cyst, then if you come from proximal to distal direction, as soon as the femoral condyle appears, then you can think that on the left side, the muscle which is being seen, that must be the gastrocnemius. And when you are in a proximal position and you are yet to reach the condyle, then the muscle should be the semimembranosus muscle. Here we have aspirated the Becker cyst and now we are injecting 20 mg of dipomethylprednisolone inside the Becker cyst. Join Asian Pain Academy to master the ultrasound of complete knee joint.